The flu is never good, and this season is particularly bad, but we wanted to know why. ABC's chief health and medical editor, Dr. Richard Besser, joins us now with why there are so many cases and how to protect yourself and your family. Good afternoon, Dr. Besser. How are you?
I'm doing well. Nice to be here.
Well, tell us, how bad is this flu season?
Well, we don't know yet whether this is going to be a very severe flu season, but we can say that it's one of the earliest flu seasons we've had in years. It's been at least a decade since we've seen this much flu in December and January, and that's caught a lot of people off guard.
Do we have any idea why it has been worse?
You know, that's the big question. Scientists have been trying to figure out what starts the flu season. Why some years does it start late and some years early? Some thoughts are if it's a new strain that people haven't seen, it may start earlier. If the vaccine isn't a good fit or people aren't getting vaccinated, it could start earlier. But one of the most interesting theories has to do with humidity. And the lower the absolute humidity in the air, the earlier the flu season will start.
And one thing we want to underline is it's not too late to get a flu shot. The question is there anybody who should not get vaccinated?
You know, the only people for whom flu shots are not recommended now are those under 6 months. They just don't get an immune response to that. Everyone else, it's recommended. I wish it were a better vaccine. You know, some of our shots, like measles, are 95% effective. The flu shot's only about 60% effective in adults. It's about 85% effective in young children. And in the elderly, it doesn't work great. So they should get the shot, but if we all get the shot, we'll help protect them as well.
Now, many people have had the flu at some point in their life. How do you know when you're sick enough to go to the hospital?
Well, you know, it can be pretty hard to tell sometimes. Do you have the flu or do you have a bad cold? With the flu, it tends to be lots of body aches, fever, cough. You usually feel terrible and don't want to get out of bed. You should see your doctor if you have an underlying medical condition, any lung problems, heart problems, kidney problems. They're going to want to start you on an anti-flu medication very quickly. Or anyone else who's developing difficulty breathing. You need to be seen then to make sure you're not developing a pneumonia.
What's the greatest danger from the flu? I mean, we saw Secretary of State Hillary Clinton who fell because of dehydration. Is that one of the biggest concerns?
That really isn't. The biggest concerns are getting a pneumonia on top of the virus, and that can be very severe. The flu in people who have heart disease can help tip them over into heart failure. And in the elderly, people in nursing homes, the flu is sometimes one of those things that leads to the end of their life. And so you have to take the flu very seriously. Many people say, who cares, it's just the flu. For many, just the flu is very, very serious.
So you want people to get vaccinated now. It's not too late.
It's not too late, and for kids and young adults, you don't even need a shot. You get it this nasal spray. There's no needle involved. There's no ouch. Just get in there, get it done, and get it over with.
All right. Dr. Richard Besser, thank you, and good health to you.